seal. We laugh, we learn, we go too deep. Sometimes the tea's too hot to keep, but we're here, no shame, just chill. Grab a snack, let's talk what's real. Welcome to the Feel and Spill, where the combo's hot and the vibe is real. We fill your plate and spill the tea with honesty, heart, and a little therapy. Yeah, come hang for a while. It's all love, all laughs, all style. This Feel and Spill.
Hi guys, welcome back to the Fill and Spill podcast. You guys already know us. We have a special guest today, Crystal Miner. You want to introduce yourself today?
Again, I'm Crystal Miner. I am a women's health nurse practitioner. I currently work at Mariah, Parham Women's Care, and I'm happy to be here today. Thank you for having me.
Of course, we're glad you're here. Exciting information that we have today. So today, what are we talking about today? I'm in La La Land today. Just had a busy week at work, so
In light of April, it is Sexual Assault Awareness Month.
Oh, great topic.
Yes. So we're gonna talk about sexual assault awareness and some concerns and questions that I think most women and also men also have, right? When a sexual assault has occurred, what do we do, right? Especially it's a significant trauma, right?
It is.
And so what do you do?
So what do you do in terms of right after the assault occurs? We can do a couple different things. It depends on what the lady wants, or the not lady, but in general, but what the person wants.
Yeah.
So I encourage, if there's a sexual assault that has occurred, that go to your nearest emergency department. And the reason being is because there they can conduct an interview. They can treat any acute injuries that are going on. They can assess to see if there's any risk for sexually transmitted infections, including HIV, as well as pregnancy. And if we identify any of those things, then we can give you prophylactic medications to treat infections, including prophylactic HIV, preventing back from being exposed to that, as well as if we need to do something for Plan B to prevent a pregnancy, then we do have those opportunities. And time is a factor, because we want to be able to interview victims right after it occurs, so that we can get the most information when it's fresh in your mind and you can get a good history, as well as we encourage victims to not shower, don't douche, don't wash your mouth, don't brush your teeth, don't take any clothes, don't do any of those things, because we will ask you a question if you want to collect evidence. And it is okay to be undecided, because if we don't want to press charges, then we can have the evidence just in case you change your mind at a later time. But if you already know that pressing charges is not a thing that you want to do, we still encourage you to come, because you can receive care. And ultimately, that's the most important thing at the time, is receiving care and having access to resources that you will likely need in the future.
Okay, that's great. I know there's a sense of fear for some people that are scared to just, go to the hospital, or, because they get threats from that person that sexually assaulted them. So how do you manage that perspective if like a person comes in like, I'm too scared to tell you who did this?
So it's all about trauma-centered care. And if they're not comfortable in sharing that information right now, that is okay. You don't have to share. You only share what you're comfortable with sharing. And again, we just want to make sure that you are taken care of physically, because a lot of times during the assault, you have obtained or sustained injuries, and we want to make sure those are addressed. And, the psychological trauma that happens along with it, you're going to need support and you're going to need resources. There are advocates that are there. We can connect you with resources specifically for victims, because sometimes you or you're in a situation where you can't talk about it now because it's too fresh, it's just too new. But over time, there's a support group that other people that have gone through the same thing, that you all can lean on each other, you can support each other. And again, I can't emphasize more. It's all about what you're comfortable with. And going to the hospital is to be a non-judgmental zone. And we're not going to judge. We're not going to blame you or anything like that. It's just all about identifying what happened, validating your experiences, and making sure we connect you to the right people and resources that are available.
Sure.
Interesting.
What does the timeline look like as far as like if you decided you wanted to have evidence collected, typically?
So we want, the sooner you come, the better.
Sure.
And if it's been a couple hours, then the longer we wait, we start to lose evidence.
Sure.
And so we encourage it. The second, when you come in and you've been identified as a victim, I used to be I'm a women's health nurse practitioner now, but I used to be an emergency room nurse.
Okay.
And so they would come up to, the triage area, and they would say, hey, I've been sexually assaulted. And at that moment, that is like, okay, red flag. We need to get this person, they don't need to go back out to the lobby to wait.
Right.
They need to be taken immediately to a room where they can just be by themselves for just a minute, and then they can be connected with a specific person that has been trained in collecting evidence and interviewing the patient or the victim. And so those interviews are very sensitive, and I will be honest, it's very lengthy.
Yeah.
It's very lengthy in conducting the interview and making a decision of whether or not to collect evidence. But we want to make sure that we get you in as soon as possible. I would say, if you have gone home and it's been a couple hours, it's fine, still come in. But if it's been a couple days, we still encourage you to come in, and so that we can gather the information, but we may not be able to get a lot of physical evidence, but still the documentation to let someone know that this did occur, and then so that we can also get you appropriate medications, because that's a time-sensitive manner as well. So the quicker that we can get you in and get medications prescribed, then I think that would be the best outcome.
Mm-hmm. What do you do in cases of minors? Mm-hmm. How is that reported?
So minors are a little bit different. The laws are different.
Sure.
In the sense that every state and every jurisdiction has, their requirements and the reporting. But as an adult, someone that's over the age of 18, you can make a decision whether or not you want to report. But the clinician, in the case of a minor, a lot of times they are obligated to have to report.
Yeah.
So there's the distinction between, being an adult versus a minor, that we are obligated. We do have to notify law enforcement. But also I would say with the minors that we encourage them they will have a trusted adult or someone there to advocate for them. When I worked in the ER, I know we used to call, it was an agency called the Teddy Bear Clinic. Okay. And they would have someone that would come over, and they would assist the clinician collecting the evidence, because we definitely want to be mindful and not create additional trauma for the minor in collecting evidence and trying to get a good history. So there are trained professionals that are there to work with providers and clinicians in gathering history as well as evidence.
Interesting.
I can imagine that's even more scary, right? Especially being the parents.
Yeah,
it is
bringing the child in.
Yes. There needs to be support on all levels. Support for the parents, because I can only imagine if someone sexually assaulted my child, I'm like, first of all,
sure,
I might go crazy.
Right, absolutely. So we have to support them, because they're going through it too.
Yeah.
And so, trying to make sure that they are calm and to know that, we're there for them as well. that's part of, providing good care to the patient.
What if it's a family member sexually assaulting a child that's in the same family?
Right. And that's where, those advocates come in, and that they can help guide us, and then they can help, gather information from that interview to determine if it's a family member, and if so, care is a little bit different, making sure that the family member is not present when the interview is going on, and that there still is the advocate or the person that is dedicated directly for that minor.
Interesting.
Yeah, they have to, typically CPS, right? Because CPS will be
Yes,
responsible.
Correct.
Yeah.
They would come in and they would interview separately, right? And do those kinds of things. And that can go a variety of different ways, of course, with CPS, obviously, when they get involved. But that's like one of the things is that they will come in and they will interview, right? Because they want to make sure that if it is a family member, they're making sure that they are safe, and if they have to be removed from the home, right, to maybe stay with another loved one or somebody who can stay with them and take care of them until they can figure out like the situation, then they'll kind of like come in and do that kind of stuff.
I'm curious to know, is there like some kind of programs out there that will help teach and in a sense of preventing something like that to happen to you or like a minor or anybody? Like, is there anything out there that can teach people like this is the red flags that you should be aware of if you feel like you're put in that position?
Right. That's part of, when we go to make sure that they are going to their pediatrician visits, and asking those questions, asking those questions. Are you being touched inappropriately?
Yeah.
Are you, is someone, doing things that you feel uncomfortable with, and identifying those things early on, and just asking the questions. And then in asking the questions, then that can, encourage the minor to be able to notify a teacher, to notify, a trusted adult that such things are going on, so that it can be investigated. And with children and minors, it's just important to gain the trust.
Yeah.
To let them know, okay, and not to victim blame or shame, just to let them know that this is not your fault, that this is happening.
You're not getting in trouble.
You're
for
not going to
telling
get in trouble.
me
Absolutely.
what's going on.
Yes, and so that's why I'm so grateful for you guys highlighting this, because it's such an important topic, and that it's often, taboo and people don't talk about it.
Yeah.
But we need to know these red flags. We need to know, what to look for, differences in behaviors at home. Is your child acting out? Are they doing things that they haven't done? And is it all because of, behavior that stemmed from a sexual assault? So it's just important that we make parents aware that, that for things that they should look for.
I know a lot of parents out there have a hard time of how to talk to their kids about, not to have anybody touch certain areas. How do you help parents explain that to their child? Like, for instance, if somebody has like a 5-year-old who's probably not aware of like what that is, or what it means, like how do you explain that to a child? Like, because my son's about to start school, so this is big for me to learn.
And you want to take it? I can take it, or you want to take it? You say like, these are your private areas, right? No one should be touching these areas, right? And you say like, no one should be touching your penis, or no one should be touching your vulva or your vagina, right? In these things, and actually saying what the actual parts are, not just saying like your pee-pee, right? And all the other terms that we identify, right? Because if your kid comes up to you and says, well, somebody touched my penis, you're going to be like, Okay, this
what
is
it?
right. Like something's going on. There's something
Like,
that's
we need
happening.
to take further steps. to
Right,
figure out.
because you're teaching them early sex education and
That's
how
correct.
to identify the red flags, right? Who am I safe with? Who am I not? Right? And it really starts younger than 5,
Yeah.
right? Because you have a lot of kids that go to daycare,
That's correct.
right? And they're with other people that, you don't
You don't know
specifically
them.
know very well, right? Or even when they're just out in public, right? You're going into the restrooms and things like that, right? That's the purpose, is that you have to start teaching them when they're young. So when they are older, right, they can hopefully either remove themselves from the situation, right, or be able to get help.
Definitely. Yeah.
I agree. And
Yeah.
I think it shouldn't just be one conversation.
It should be
Absolutely.
But it should
multiple.
just be ongoing. As a matter of fact, this is something that mom, dad has always said. And so when it happens, I need to tell someone immediately. And again, like, I love it that you said, call it what it is, name the part so that they can be educated, and they can be educated early. And so start the conversations. There are books that are available that can help moms and dads to be able to get during bath time, have the conversation like, this is, what it is. It's okay if touching your own parts and cleaning your
Yes.
own self. But if other people do it, that's a no. You don't do that.
And if you touch your parts, right? Because I also tell kids, sometimes when you touch your parts, it feels good, right? And if you want to touch your parts, you do that in your room when you are alone, in your alone time, right? And things like that. So that way you can kind of distinguish what's appropriate and what's not.
Yeah. So parents out there, teach your kids. It's okay. Take your time.
Absolutely.
Yeah, reach out for help if you need any help. I'm sure there's programs out there, books that you can look up that will help, have that conversation with your child at an early age.
How does trauma impact, pelvic health, pelvic pain, your menstrual cycle?
It impacts it a great deal.
Yeah.
I see a lot of patients that come in and they have pelvic floor dysfunction.
Yep.
A lot of times when you have the trauma, you are sexually assaulted, your body is in this constant fight or flight.
Right.
And, your pelvic organs, they kind of act like a guard dog. It's like it's your safe space. And so when it's constantly activated, we tend to see patients have this chronic pelvic pain that you can't identify with on imaging. There's no blood test that will identify, why am I having this pain? And it all resorts back to, a lot of times, the emotions of the trauma that has caused you to get into this tension cycle.
Sure.
And so the stress is held in the muscular pelvic floor area. And a lot of times we'll have to refer patients to pelvic floor physical therapy.
Mhm.
That's also accompanied with therapy to be able to process the trauma that happened.
Right.
So we see a lot of that. Sometimes we see urinary issues such as incontinence or fecal incontinence. Sometimes menstrual cycles you can see irregularities with that. Sometimes after the trauma, periods can become heavier, longer, crampier. The menstrual cramps can intensify, and all of it has to do with anxiety, emotions, activation of your central nervous system, all of those things. So sexual trauma can affect a variety of different things, including pain with intercourse,
Right.
or dyspareunia. It definitely can affect intimacy and relationships and those kind of things.
Sure. And I can imagine also, I know with, obviously certain kinds of sexually transmitted infections or diseases, right? Like you can also see pelvic issues with that as
Yes.
well. And so I can imagine that also brings another layer, because then you're not only treating the discomfort that's there that you didn't want to begin with, right? And then you're also having to take medications to prevent those things, and it's a mess.
It is. I see so much of it, and it's patients often come in and they're just so anxious. They're just
Sure.
the anxiety, just generalized anxiety, and they don't know how to process it, and their relationships are affected.
Sure.
Their activities of daily living and how they normally would go about in their life, all of that is affected.
Mhm.
And it's not until that the trauma is identified and they are linked and with appropriate people that can help them process that and to get through it. And it's not something that you get through in just one session, but
Absolutely.
it's ongoing. And just to know, they need to know that it's not their fault. And the things that happen, especially when they're in relationships and now they're having problems or difficulties with arousal or a lubrication.
Yeah. I've had
It's
many clients who
Yeah.
experience that.
absolutely.
Yep. Yep.
And it takes time. They have to allow themselves grace and to be able to have conversations with their partner
Mhm.
so that their partner can know how to support them
Sure.
and not make them, feel bad for not being able to enjoy sex the way that they used to,
Sure.
and helping them, and also they're allowing their body to respond as it normally would, because trauma happens, so things are different. So now
Right.
we have to approach things differently.
Well, because it's also when this kind of trauma happens, right? It's systematic, right? So then we have to have support systems, and that might be therapy. We might have to have support systems in pelvic floor,
Correct.
right? You go see a gynecologist, you get treatment there, right? So there's multiple things, and it really just takes a village
It
at that
does.
point,
Absolutely.
right? When there's significant trauma that has been done.
Absolutely.
Can you give more description or describe the forensic, like eval, like when they conduct a rape kit?
Yes. So they come in and like I said, we get a detailed interview. We not trying to be intrusive or, to pry, but it's important to just document specifically, giving good timeline of what happened, who was there, any type of detail that you can remember, all of that will be helpful. So they'll come in, they'll do an interview, and they'll talk, and they'll get all of the information. They will move on to the evidence collection. They're going to collect hair samples, hair samples from your head. They're going to collect that. They're going to collect swabs from your mouth. They will collect vaginal swabs. They will collect pubic hair. They will have you to basically strip all of your clothes off, and then they will collect the clothes in a pile, and that will also be used as evidence. They will take nail samples. They will look all over they will do just an all over body examination just to see if there's any like scratches, any scrapes. They're going to do a pelvic exam to look for any vaginal tears or any evidence that can be collected there. So it's it's an invasive exam. And it's important for the victim to know that they're in charge, that we will stop the exam, we will pause the exam until they're comfortable to proceed and to move on. So it's a lot, but I think it's important to be able to have that evidence so that if and when the time comes that it's needed, then it's there. And also, a lot of times it may take you a while to be able to decide the evidence. They get in contact with law enforcement, and they do maintain chain of command, and they store these kits at a lab, and is whenever you're ready to use it as evidence, be it of 6 months, a year, or whatever. We can definitely pull it at that time.
And if I'm not mistaken, right, so when they pull hair samples, it's by the follicles, is that correct?
Correct.
Okay, so so it is very, very invasive.
It is.
Yes.
Given the medication aspect, do they initially give the medications at that point, or what type of medications gets administered?
So they will give medications to prevent HIV, STIs, and as well as the Plan B or emergency contraception.
What do you because I can imagine you've met your fair share of providers, just like I've met my fair share of providers. What would you recommend for those as far as providing better trauma-informed care? Because of course I've run across providers that are not as trauma-informed. What would you do? What would you recommend for those providers?
Well, I would recommend, first of all, whenever I start my visits, I like to come in and introduce myself to the patient. I don't like to jump right in to, well, you're here for your exam today. Well, I kind of want to have some lead-in questions like, hey, you're here for your exam. How was your weekend? Did you do anything fun this weekend? And then when you do that, you can notice people, they drop their shoulders, they relax. So it starts there. And when we have to get to the topics of, have you had any sexual trauma, or is there anything going on? Do you feel safe at home? When we get to those questions, it's just important to take your time.
Sure.
And, allow the patient, just tell the patient exactly, well, this is what the visit's going to be today, and what's going to happen during the visit. Because when a lot of times, especially women, when they come to the GYN visits, it's like they worry about it the night before.
Sure.
It's like they're thinking about it, they're concerned, and they're just tense and uptight because no one really likes that exam. But
No.
But if you know how the exam is going to go, we're going to just, to begin with, we're just going to talk. We're just going to talk, and we're just going to, update your history and those kind of things. Then when it moves on to the physical exam, okay, I'm going to listen to your heart and lungs, and then we'll proceed on, if you're comfortable, with the breast exam, and we'll end with the pelvic exam, and we'll collect your pap smear and swabs at that time. So I think that will help, ease their minds and like, okay, this is the order of the visit, and this is what's going to happen. Also, ACOG says that pelvic exams should be a shared decision. Pelvic exams, breast exams, it should be a shared decision. If you're not comfortable with a pelvic exam today or breast exam today, that's completely fine. And also, there are instances where, we can allow the patient to self-collect. And I encourage self-collection, that way we can still get the answers we need, but they aren't triggered.
Well, and also I think that's also a good way to promote like that when they're at home, right? Because then they can start noticing, okay, like when they do a self breast exam, right? So that if they notice anything like a lump or something, that they identify and be like, I need to go in and get this taken care of.
Absolutely.
Right. And just like even with down there, I mean, it's important education for them to know.
Absolutely. What feels normal to you.
Absolutely.
And then so that we can report what's abnormal, and we can identify what it may be, how we can treat it, and encourage you to do, as much as you're comfortable with.
Yeah, I agree. I think that's very good. Yeah,
it's a lot of good information, guys.
Absolutely. I mean, it's just, we're here as a women's health provider just to make sure we want people to be at the core. We want you to be healthy. We want you to be healthy and safe. We want you to be healthy in body. We want you to be healthy in mind, healthy in emotions, healthy in your relationships. And however that looks, if we have to modify our visit to ensure that you are safe, that you are healthy, and that that this is a safe space in which you can disclose information, and you only have to disclose what you're comfortable with. We're not going to pry. If you just want to say that, hey, I'm a victim of sexual assault, that's enough for me to know that, okay, well, I need to approach this visit a little bit differently than I normally would any other visit. And so I think that as providers, that we just need to make sure that we are asking the questions, training our staff to be during intake to say, to ask those sensitive questions so that they can tell the intake nurse, hey, these are my triggers. These are my boundaries. This is what I'm comfortable with. This is not what I'm comfortable with. And so that information can be passed on to the provider so that the exam can be tailored towards the victim.
And it helps them practice like self-advocacy with providers.
Absolutely.
Right. Because I don't think that is taught enough
I agree.
right? Because then they can be prepared for their visit, come in with questions and ask you things. And I think that's very important for women to do, because a lot of times women are dismissed in the field.
Oh my goodness. Yes, they are. They are dismissed. They're pain. Everything is brushed off.
Absolutely.
You know, and it's like no one is taking them seriously. And it all just begins with just listening.
Yeah.
First, it begins with listening and just hearing what someone has to say and validating how they feel. You know, it's just because maybe, you know, other providers because they have not had that experience and they have not had, you know, had to deal with or provide trauma centered care.
Sure.
Then they don't know. And then
Right.
patients feel dismissed and brushed off and their issues are not addressed. And then they are not the whole person that we want them to be.
Absolutely. Absolutely. What's the best piece of advice you would give to our listeners?
I would say advocate for yourselves. Just advocate. Don't be ashamed or don't be afraid to speak up and let people know what you're comfortable with, what you're not comfortable with. And just know that when you go to a GYN exam or see a GYN provider, that is a safe space and that you will not be judged for whatever trauma that you went through. And if you feel that you are judged, then that's not the provider for you.
Yeah.
That is not the office. You need to find someone that you can build that rapport with, that you can be transparent at your visits so that you can get your issues identified and taken care of and addressed in a manner that's comfortable and that you're comfortable with, and that you know what it takes to be safe, and that you can pass this information on to, you know, your family members, your friends, so that we can create awareness and that we can make sure that our community is safe and that women are heard and we are able to treat them and meet them where they are.
Absolutely. I agree 100%. And I can get testimonials, so I can say that Crystal is a good provider because I've worked with Crystal. So I know she's a good provider when it comes to that kind of stuff. And I wish there were more providers that were like that, to be honest. I do.
I wish a lot of providers would be as empathetic as you in situations like this.
Absolutely.
Yeah, so we highly recommend Crystal, guys. We will leave her information to where if you have any questions to contact her, if you don't mind.
Yeah. How can they contact you? How about we start there? How about we start there? How can they contact you?
Okay, and I am currently practicing at Mariah Women's Care. I'm in the Oxford location Monday through Thursday, and I'm also in the Lewisburg location on Fridays. And so if you have any GYN or even OB needs or any issues or concerns, please come see me. I would love to be your provider, and I will most certainly treat you with the utmost respect, and we will get whatever issue it is taken care of.
Absolutely.
Nice.
Absolutely. Well, we appreciate
We
having you on the
appreciate
show.
you coming
Thank
in.
you. And come and talk about us, obviously a sensitive topic.
Absolutely.
Yes.
All right. Well, I would love to come back.
Yes. No, you
we
definitely
will
come back.
have you back.
You're definitely come back.
All right.
That's for sure.
Thank
So,
you. Thank you. Thank you.
All right. Well, guys, that is our episode for today. We will see you guys again soon.
at the Fill and Spill podcast. We're out, guys.
Bye.
Bye.
Oh yeah, fill it up, spill it out. Oh yeah, fill it up, spill it out. Oh yeah, fill it up, spill it out. 'Cause OG and Beth know it's about. Da 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 da. Fill it. Welcome to the Fill and Spill, where we laugh to laugh. We fill your plate and spill the tea and spill the tea. Pull up a chair, unwind, your family, your every time. This the Fill and Spill. Oh yeah, fill it up, spill it.